University. Very good to have you with us. So an important day highlighting a pretty devastating disease.
Yeah, I think it's good to get awareness of this disease because, as you said, it has a very low survival. And compared to average cancers, I mean, people may not know it, and as you said, that cancer is a very devastating diagnosis to get. But more than 50% of people with cancer, if you take cancer as a whole, survive actually more than 5 years. If you look at pancreas cancer, probably 6 to 9% survive 5 years. So that's the difference. It's not one of the commonest cancers. It's only about 9 or 10 or 11 in terms of frequency, but it's one of the most important causes of cancer deaths. Probably the 4th commonest cause of cancer deaths and soon to become the 3rd commonest cause.
So what should one look out for?
I think the warning signs that people really should look at and consult their doctors, and their doctors must also be aware of it. The first is jaundice, where the eyes become yellow and the stools become pale and the urine dark. That needs to be properly investigated because it could be a tumor or a cancer blocking one of the bile ducts. The second one is a new diagnosis of diabetes. Now, diabetes is common, and the majority of people with diabetes will not have cancer. But if you have a new diagnosis of diabetes, the patient should be investigated in case there may be a tumor of the pancreas. The third one is persistent and ongoing pain in the upper abdomen, often moving to the back, unexpected weight loss, change in the stools, where the stools become very oily and loose. Those could all be signs of pancreas malfunction and should be investigated further.
And obviously investigated immediately, start treatment as quickly as you can.
Yeah, I think the investigation, the problem with one of the problems with pancreas cancer, it often presents late. Because sometimes they don't present with early symptoms, and even when the symptoms do present, the cancer is quite advanced. And that's one of the difficulties we face, is in diagnosing enough people early on that we can provide effective treatment. And the investigations that are required are quite intensive. It's usually CAT scans or MRIs or internal ultrasounds. So they're not easy tests to do. But once we've investigated and made a diagnosis, we can determine the treatment. And the treatment depends on how advanced the cancer is. If it's early, a major surgical operation is possible and may be helpful in trying to cure this cancer. If it's more advanced, then it tends to be this control of cancer, or what we call palliation with chemotherapy or radiation therapy.
Is there anything we can do from a lifestyle point of view?
Yeah, look, I think you can look at it in two ways. The one is things that we can't do anything about, our genes, family, etc. The things that we can do something about is avoiding obesity. That's one of the biggest causes of cancers in general. Chronic alcohol abuse is another one for pancreas cancer, and smoking. Those are the 3 big ones that we can do something about.
All right, Jose, good to talk to you. Thank you very much for that.
My pleasure.